Welcome to Charter Local Edition. I'm Tracy Young. Our guest is Assemblymember Dr. Ed Hernandez, who represents the 57th District. He joins us to talk about legislation that he has authored that would create a commission to address the shortage of all kinds of healthcare workers, from physicians to nurses to dentists. Good to have you with us, sir.
Well, it's great to be here.
You and I were sort of speaking earlier about, a lot of discussion right now is in regards to healthcare and the need for us to try and at least transition at least a huge portion of people who are uninsured to being insured. That's a great idea, but if we are able to accomplish that, do we have the workforce available to service those people?
We definitely don't, and as you know, we're talking about it at the federal level. And even if we were to have universal health care where every single person has the ability to see a doctor, right now there are not enough primary care providers to be able to provide the care in this country and especially in this state.
Speak for a moment, because I'd like to go through a couple areas. Why do we not have enough primary care physicians? Well,
a lot of times physicians, when they graduate, they go into specialty care. And the reason why they do that is because the reimbursement rates is a lot higher. And unfortunately, in the state of California, and especially in this state, is the reimbursement rates for Medi-Cal is so low that there's a disincentive for individuals to want to go into primary care.
Also, nurses have been reading quite a bit about the fact that a lot of our trained and really experienced nurses are baby boomers, and they're starting to retire, and that we've actually shut down some of our nursing schools. So at the same time that our population is expanding and people are retiring, we're not educating enough nurses.
Very much so. And the other thing too is we have laws that have patient to nurse ratios that we can't even mandate or even come up to be able to meet those needs. You have hospitals that are actually stealing nurses and recruiting them away just to meet those mandates.
What about some of the other specialties, you yourself as a private practitioner?
Right. Well, it's not just physicians, it's all primary care providers, whether it's dentists, podiatrists, chiropractors, and it goes beyond that. We need to make sure that we get enough ancillary help, technicians, but more so you need to make sure you get those individuals to go into the areas that need it the most. Those are the communities of color that have the highest incidence of chronic diseases.
And what's the issue there? Are there not enough people going back into those communities and serving?
Very much so. And what happens if you look at really trying to solve the healthcare crisis we have? For example, communities of color like African American and Latino have the highest incidence of chronic disease like diabetes and high blood pressure. And those are the biggest cost drivers that we have right now in our healthcare system.
So what is the idea, or what's the philosophy, I guess, behind your legislation?
Well, what it's going to do, it's going to create a master plan for the state of California. The first time ever to look at trying to address the workforce shortage in the state of California. And it's going to try to figure out the best way we can get providers to these communities and to get more individuals to go into primary care.
So somebody gave you a magic wand and said you can do whatever you want. What is your philosophical approach? Is it about opening up new schools? Is it about recruiting people from other states or other countries? What's the idea behind this?
To me, the best way to do is to try to reduce the amount of costs for medical school, optometry school, dental school, etc., to reduce those costs, but to encourage individuals to go into primary care, not into specialty care, but most important, to get those individuals to go to the communities that they need it the most to be able to reduce the cost or to reduce the amount of chronic care that we need or chronic diseases.
So what's the idea? This commission would start putting together the master plan. They would create the master plan, and then we would go forward from there?
Right. Once the master plan is developed, then they would give the direction to the state of California of how you would do it. For example, our university systems have a master plan of how we deal with the educational process in the state of California at higher education, whether it's CSU, UC, or the community colleges. And I believe we need to do the exact same thing for healthcare.
All right. So this has passed both the House and Senate,
That's
and
correct.
It is sitting on the governor's desk for his review. We'd certainly love to have you back. This is, I think, a very important issue, not just for us here in SoCal, but the state and the nation. We appreciate your time very much.
Thank you very much.
You're welcome.
Great.
For Charter Local Edition, I'm Tracy Young. Now back to CNN Headline News.
I'm Brad Pomerantz, anchor for Charter Communications CNN Headline News Local Edition. Now, if you've missed any of these interviews, you can always watch them through Charter's video-on-demand free service, 24 hours a day, 7 days a week. Now, to access all of Charter's Local Edition interviews on VOD, please go to Charter's Channel 1 and then click on Community Interest and then click on Government and Public Affairs. And thank you for being a Charter customer.